So this is episode 2 of the Canna-Manual podcast, where Chris will be discussing his work on the cannabis cooperative that he helped set up, or sometimes referred to as cannabis social clubs. And basically I'm just going to pick his brain a little bit about how he got that set up and what it is and what it's about. Is that alright?
Yeah, awesome.
Alright, beautiful. So, first off, Chris, what is a cannabis cooperative or a cannabis social club?
Now, a cannabis cooperative is essentially a drug consumption room. Now, we have a lot of drug consumption rooms around the UK in many forms. So we've got cafes, for example, which sell drugs in the form of caffeine. We have bars and pubs which sell alcohol, a drug in the form of beer. And we can also buy cigarettes and go to cigar lounges and smoke cigars in what is essentially a nicotine consumption lounge. And so across society we have various forms of drug consumption rooms, and essentially a cannabis club or cannabis cooperative is a method of essentially doing the same again, but producing a safe location for people to consume cannabis. And so this is part of a new political stance and a new policing method which is called essentially harm reduction. Harm reduction is a new form of policing and perhaps a new stance that's being adopted in academia and research, and a new way of treating drugs, and it's a new stance on how essentially we deal with drugs. So across the world, people are using drugs daily in the form of nicotine, caffeine, alcohol, heroin, methamphetamines and cannabis. And so as a society, we've now more or less accepted that cannabis is safe, it's got health and therapeutic benefits, and it is an abundant source for all sorts of industrial materials and products, and is becoming far more socially acceptable. Now, in the not too distant past, we obviously had alcohol prohibition. We've had numerous things sort of prohibited throughout history, but as we develop as a society, we then sort of liberalise, and we're now looking towards cannabis as this new class of drug which has always been part of society, but up until now we've not really accepted that it exists and that people use it. And essentially harm reduction is the acceptance that, look, ultimately people are going to use drugs, they use drugs daily, we have a massive black market that benefits produces untold amounts of cash from our consumption of illicit drugs
For potential criminals.
Exactly, and so all of this money,
in all sorts.
all of this money can be essentially redirected through these drug consumption rooms, redirected into the community and pulled away from the black market, and can be used then as a fund for good, as opposed to fueling crime and perpetuating the black market and pretending that cannabis consumption isn't going to happen. We can in fact provide a safe space for it to be consumed, provide a community produced alternative, and one that cuts out the black market and redirects those funds into the community, which can then be spent on social services, redeveloping the area, and can be used as a source for social good. And so with those community funds, what we've been able to do and what we've demonstrated up in Teesside is that essentially you can intertwine health services, mental health services, social services, and all sorts of charitable organisations, and offer them a community hub where they can interact with drug users, educate them, introduce them to safer methods of drug consumption, as they're using it anyway, they're using it right now. This is a method whereby we can address the situation, work with them, show them safer ways of taking drugs, and essentially reduce the wider societal harms that come from that. So we can stop people getting lung disease, having to then have treatment through the NHS at additional societal costs. That money's not going into the black market to fund crime. We can sponsor members of the community who are less fortunate, provide them with housing services, connect them with different social services. People who've had traumatic upbringings, a lot of this work is done in impoverished areas, and so we're able to then identify people who've developed mental health problems as a result of obviously the traumas of their childhood, treat them with respect and understand their circumstances. And this is part of a wider sort of political shift in our perspective of drugs, and moving it away from a criminal issue and making it a health issue, because the majority of them experienced horrific traumas. The entire families of theirs have died. They've lost loved ones in wars, and again, the life can be cruel. And if you've been brought up in a family where you've been abused in all sorts of horrific ways, that carries on to later life. And what we're finding now in research is that the majority of drug addicted people who are homeless and turn to heroin, a lot of them have been abused sexually, mentally, and physically abused. And so we are persecuting vulnerable people who are there as a result of crimes that have happened to them and horrific events in their life. And so they are the product of their cruel upbringing, really, and they are
well, they're penalised for simply trying to cope with...
Exactly, and so a lot of drug consumption is a coping mechanism, and so these drug consumption rooms, these cannabis cooperatives, are a way for us to actually work with these drug consumers who are, at the end of the day, members of our society, and some of the most marginalised members of our society. By bringing them into this community, we can build a community, rebuild a community, connect people. People can make friends, bring their support workers with them. We can connect them with counsellors, and they can rebuild their lives. They can have their mental issues and their personal hardships addressed, and help them work through those and move away from drugs as a source of relief, and move them towards a more sustainable and less self-destructive method of working. And so we're seeing this not just with cannabis, but right the way through to heroin, methamphetamines, and providing a safe space for people to consume drugs. Otherwise, as we see and have seen for the last 40 years, 50 years with the war on drugs, people are going to consume drugs anyway. And if we're not providing a safe, clean source, they're going to go to the black market, and the black market will fund that at any cost. And these cannabis cooperatives are really a means for social change, and a great indication that our police forces, our communities are developing and saying that, look, what we're doing clearly isn't working, and we need to reevaluate our stance on drugs as a whole, not just cannabis. Cannabis is, again, just one drug. We have tons of socially acceptable drugs. We can buy paracetamol over the counter. We can drink alcohol socially, and it's commonly accepted that you would go and drink 5 to 10 pints on a weekend with your friends and stumble home. Why shouldn't someone who can't drink, or someone
who doesn't want to drink,
perhaps doesn't have the tolerance for alcohol? And so we are pushing them towards a black market potentially. And again, this is all money that is already going into the black market. And I think most recently we had, the black market is worth, or the illegal drug market is worth 2.5 billion to 3 billion at least, and that's what we know about.
Yeah.
All of that money all of these are funds that could be going back into the community, being reinvested in.
And you have no idea what
health,
that
education,
criminal money is actually going towards. It could be bringing weapons in, could be all
and
sorts.
This is a model that works for the police, works for the community, works for the legal process, takes people out of the criminal justice system, stops patients being caught up in with organised crime, and is a way for us to regulate drugs, and in a safe way where we can educate people how to use them safely, reduce the burden on the NHS, reduce hospital call-outs, reduce police call-outs. And it's something that we should be adopting more readily across societies. We don't educate people, for example, when they're buying their alcohol, when they're buying the cigarettes, we just tell them how dangerous it is. We don't show them safer ways of using alcohol, or for example, show me calories are in alcohol. So there's a lot that we could be doing right across the spectrum in terms of caffeine. Same goes for coffee, in terms of drugs, and same goes for coffee. You can die from a caffeine overdose quite easily.
Yeah.
It's very difficult to die from a cannabis overdose. And so there's a lot of perspectives that need to be balanced, and there's a lot of discussion there to be tapped into. And one fun fact for you, if you've had 3 to 4 traumatic experiences in your life, you are 4 times more likely to have a drug addiction, suffer from depression, or make an attempt on your life. And so if you're a child who's been brought up in a scenario where you're being beaten daily, abused by your alcoholic father, choose a horrible scenario, that really starts to build a really disappointing picture right across society when we walk past homeless people every day. Who knows what's happened to them in their childhood, in their past, what's led them to feel worthless and escape life through drugs. And so
these are all aspects that should be being questioned and investigated, rather than the fact that they're smoking some cannabis to cope with what's happened to them.
Exactly. And so we're criminalizing really the victims of childhood trauma and any form of trauma, really mental trauma, and these are scars that we can't see. They're mental scars, and they imprint on a person just as much as a physical wound, and more so than a physical wound. Yeah. And so these drug consumption rooms are a humanitarian way of dealing with people who are essentially marginalized by society and are, again, most vulnerable, and people who have already fallen victim to some of the most horrific scenarios, crimes, and some of the darkest parts of life. And so I really see these cannabis clubs as a force for good and a way for bettering social health mentally, physically, and making people more aware of how they can be safer right across the board. And rather than us pretending drugs don't exist and that illicit drugs aren't consumed,
we should find
a way to deal with it, really.
Sustainable ways of dealing with it, precisely. Okay, so you've experienced setting one of these up in Teesside, and what was that like? How did that go?
So in Teesside, the Cannabis Club was initially pioneered by Michael Fisher, who was an activist. He himself had used cannabis for his gut condition, as yet still undiagnosed. We don't know, gut conditions are so complex, we know very little about them. All he knew is that he was getting relief from cannabis and had been through much of his adolescent life, and so from that it ended up growing out into a bit of a activism that fueled a passion for activism. And after a trip to Spain, saw that these social clubs were a viable method, they existed, and said to his friend, I'm going to make one of these happen in the northeast at home. And so in Teesside he set it up, started off as an online community where patients connecting together, and not all patients, of course, there were recreational users amongst those, but the most important thing was they weren't going to the black market then. They were operating within this communal bubble. And so that built out from word of mouth, essentially. They put together events, raised awareness, and over the time this model's adapted to incorporate obviously the elements from the Spanish social club model, and there's lots of cannabis club models around the world, but this has been integrated in a way to solve the unique problems of the UK at the moment, which are drug addiction, poor health and poor mental health at the moment, and obviously high rates of depression. We've got all sorts of health issues that these cannabis clubs are now able to tackle. So it started off as a online group meeting up in fields to building up a discussion with the police and saying, look, this is what we've got going on here. And we were very fortunate in that the police were very supportive of what we were doing. They shared our frustration with the drug laws. They too were sick of seeing the same people coming in and out of their courts, keep arresting the same cannabis users and not being able to prosecute them because it's not in the public's interest. And so there was a mutual desire there to test something out. And so with that vision and with that shared mentality, we set forward to sort of build a plan and work with them on implementing something that would work for the police, work for the community, and solve the problems for patients, the supply.
I think the word patience is a good word to use, to be honest, because if we were in America, in one of the many recreationalised people who suffer from depression or anxieties or have been abused or suffered horrific traumas, they are patients. They are not drug addicts like they are in England or the UK. They are patients, and they can medicate themselves with cannabis because it clearly helps them, and they believe strongly that it can actually help them. And so I find it quite strange almost that the exact same scenario just across the ocean, one of them is a patient and the other is a drug addict who should go to jail.
No, absolutely. The shift in perspective. And I think the terminology is kind of the main thing, in that we use it quite fluidly. We don't have set definitions of what those words are, and so my interpretation of what a patient is could be very different from anyone else's, and vice versa. Drug addict, what do you and I say drug addict, it's a person who uses drugs and is addicted to drugs. It's a health condition, it's not a...
But then I suppose there are many people who would be referred to as drug addicts in this country who simply enjoy, or not enjoy, or so need to smoke cannabis or take cannabis derived products to help with their conditions, whereas other medications may not help or may not be very effective, and yet people would see that person potentially smoking cannabis every day, they would instantly call them a drug addict, wouldn't they? They wouldn't label that person as a patient who's actually helping fix their problems or helping, just live their life without having to be weighed down by all the stuff that they are smoking the cannabis for. But because of our society, people just negatively assume that he doesn't need it for a reason, he's just a drug addict. I mean,
no, absolutely.
I think that's a big problem to do in the area.
It's definitely difficult to overcome that stigma, and it has been thus far, but because of just how quickly the sort of mindset's shifting in the UK, it's making it a lot easier to discuss these things, and everyone else typically sees the same problems but doesn't know how to address them, and these cannabis clubs are a fantastic way to tackle a variety of issues with one simple step, and that is set up a club. People are going to consume cannabis, give them a place to consume it, let them source it responsibly from their colleagues, from their community, rather than having it grown by some poor child who's been left in a house and people trafficked here. Allow entry for charities, educational groups, health services, and it becomes then a community hub where you can educate and connect with these members of the community. Otherwise,
it becomes beneficial rather than detrimental.
Exactly. Otherwise, you're pushing them back into the black market, back into smoking cannabis secretly behind the shed, down the road, in public places. You're giving them a safe place to consume it and not necessarily smoke it either. You can get them to vaporize it, consume edibles. There's a number of ways we can then reduce the harm of that cannabis consumption. We can show them not to use it with tobacco, the harms of using tobacco with cannabis, the harms associated with bleached white papers that you'd roll your joints in, and provide safer alternatives. Vaporization as a method where you get 80% of the cannabinoids, 80% cannabinoid recovery ratio versus a 30% cannabinoid ratio when you smoke. So you get 80% of the cannabinoids in your cannabis into your body if you're vaporizing it, whereas if you're burning it and combusting it, you only get 30% of those. So you not only save yourself a bit of money, but you get more bang for your buck essentially. And
not to mention the adverse health effects of smoking, of burning any plant matter or any matter in general and then inhaling it. I mean, our lungs aren't designed to inhale smoke and tar and these various things, so vaporization is probably, if not the safest way of consumption, but that's not really talked about or alluded to in the UK because it's still labelled as a drug that no one should be allowed to do or take, let alone how they should take it properly. And so we feel there's quite a lot of need for this information and essentially reform into the industry.
So these cannabis clubs really offer a viable solution for a lot of the social problems and drug problems that we have in the UK, and particularly up in Teesside, where we've got the shortest life expectancy, the highest rate of drug deaths in the UK. We had to try something and see what was going on because what we were doing clearly wasn't working. No. All we're doing is prosecuting the same people for the same crimes and not really making any progress and costing the government and costing the taxpayer a fortune in the process. Yeah. And so we were very fortunate and blessed really that the police chief up in North Yorkshire,
he was very open-minded.
Extremely open-minded, and he's really been a bastion for this. And it was the late Ron Hogg that really set the way for all of this and gave Michael this opportunity to really demonstrate what they believed in and demonstrate that this sort of dream and vision could become a reality. And so Teesside Cannabis Club is really the first fully operational cannabis consumption room or cannabis cooperative, which operates as a harm reduction centre and is a community hub where we can re-divert all of those funds, all of that criminal activity into a force for education, reform and health promotion. So we've got really all the dimensions there, I think, to really convince people that this is something that's viable and really...
It seems like you've addressed all the detrimental aspects of what people assume are associated with cannabis.
To conclude on that then, if you would like to learn more about Teesside Cannabis Club, you can visit their website. They're on Google. You can buy a membership online if you want to support them. Well, thank you for listening, and we look forward to seeing you again at the next episode of Canna-Man.